Hey everyone, welcome back for another deep dive. You know how it is in the ICU?
Yeah.
Things get crazy, alarms are going off left and right.
Mm-hmm.
And in those moments, having a system you can rely on can be a real lifesaver.
Absolutely.
So that's what we're diving into today. The DOPES mnemonic. It's all about making ventilator troubleshooting fast and efficient.
Definitely.
And with us today, we have an absolute pro when it comes to all things ventilator management.
Happy to be here.
So let's jump right in. DOPES displacement obstruction, pneumothorax equipment failure, and stacked breaths. Easy to remember, right?
Yes, definitely.
But let's go beyond just memorizing the letters.
Right.
What are the subtle things we need to be watching for with each of these?
That's a great question, and it's where experience really comes in. Take displacement, for instance. You check the tube depth, it seems, right? But the patient's still struggling. What then?
Yeah, that's happened to me before. It's easy to get tunnel vision on that number.
Exactly. You could have a tube that's at the right depth, but maybe it's up against the carina, causing a partial obstruction. You might not see a big change in the depth, but the patient will tell you something's wrong. Their breathing, their sounds.
It's all about putting those pieces together.
It is, absolutely.
Okay, so displacement, we're looking beyond just the number.
Mm.
What about obstructions? What are some things besides the usual suspects like mucus that we should be considering?
Well, believe it or not, sometimes it's as simple as the patient biting on the tube.
Oh, wow.
Or it could be kinked. In the heat of the moment, you might not notice. So always check for any signs of damage to that tube.
Good point.
Especially if you're seeing those pressures going up.
And even if you can pass a suction catheter,
right,
that doesn't completely rule out a problem, does it?
Nope, not necessarily.
Yeah.
You could still have a partial obstruction that's causing trouble.
Okay, on to the big one, pneumothorax. This is serious business.
It is.
What are some early signs we should be looking for beyond decreased breath sounds?
Well, those decreased breath sounds can be subtle at first. So you got to be looking for other things like tracheal deviation.
Okay.
Maybe some subcutaneous emphysema. Even a sudden drop in blood pressure. That could be a red flag even before those breath sounds change drastically.
And I remember reading that bedside ultrasound can be super helpful here.
Oh, absolutely. POCUS, point of care ultrasound. It's become indispensable. Lets you see what's happening in those lungs right then and there.
Faster diagnosis, faster treatment.
Exactly.
All right. Equipment failure.
Yeah.
This one seems more straightforward, right?
That can seem that way.
Disconnect, go to bag valve mask.
Right.
But are there any tricky situations we should be prepared for?
Well, a disconnected circuit, yeah, that's usually pretty obvious. But what about a faulty valve inside the ventilator? That might be harder to catch. You might see pressures that just aren't making sense, or the patient's effort doesn't match what the ventilator's doing.
So trust your gut.
Always. If something feels off, disconnect and ventilate manually while you figure things out.
That makes sense.
Yeah.
And finally, we have S for stacked breaths, which I've also heard called auto-P.
Yeah, that's right. It's important to remember with stacked breaths that it often points to an issue with either bronchospasm or your ventilator settings. For example, if your patient has asthma and is experiencing bronchospasm, you might see these stacked breaths as the air gets trapped, decreasing the respiratory rate and adjusting the IE ratio. That's the inspiratory to expiratory time.
Right.
Can help address this.
So much good stuff here. It seems like the big takeaway is DOPES is a great starting point.
Absolutely.
But it's our clinical judgment that really makes the difference.
Couldn't agree more. Every patient is different,
Right.
and how they respond to the ventilator can vary. DOPES is a tool, not a replacement for thinking critically.
So to everyone listening out there, DOPES is powerful, but always be ready to adapt. Think critically.
Right.
And use your best judgment based on what's happening with your patient.
Well said.
Thanks for joining us for another deep dive. See you next time.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.